Good morning and welcome to Community Focus. I'm Faith Daniels, and this is our new normal. This is how we do Community Focus and a number of our live interviews. And it's an awesome way that you can then replay these interviews at any time on our website at 921wrou.com. In addition to that, they also are on our Facebook page. So you can share the information with family and friends and coworkers, as well as revisit it again. Now, I have the pleasure to be chatting with one of our most popular guests that we've been wanting to talk to for a while. Lots of information that we're going to be sharing today, and it's public health, Dayton and Montgomery County. Dan, we go a long way back.
Yes, we do.
and,
Always good to be with you. I like
pleasure.
this new setup here.
Thank you so much. We've had the pleasure of talking about a lot of things, and we've gone from helping in food deserts to bringing food and fresh meat and fresh vegetables and fruits to communities that don't have grocery stores or have lost them over time. We have talked about infant mortality. We've talked about a lot of things with Public Health Dayton and Montgomery County, but this is one of our more serious interviews that we've had to have together because we're talking about a pandemic that is killing people daily and has changed our lives absolutely from anything we can even fathom what it used to be. It is so different now. So let's just jump right in. COVID-19, been on the scene for a while now, and we have tried to find ways to live our lives, but we're seeing there's changes that have to be made literally on a daily basis with work as well as home and our families. Tell us a little bit about some of the things that our listeners and our viewers need to be doing every day at the recommendation of Public Health Dayton and Montgomery County.
Right. Thanks for having me here today. Enjoy it. One of the things we want to point out, you mentioned some of the previous interviews that we did, and Public Health has over 50 different programs that we work in the community and try to improve people's health and the conditions in which they live. But stopping the spread of communicable disease, that is right at the top of the list of what public health's mission is in a community, and not just here in Dayton, but throughout the United States, stopping the spread of communicable disease. So we have a communicable disease program that works on that. And all the interventions and things that we're doing for COVID are things that we do normally throughout the course of the year. So, for example, if there may be a case of the mumps, the same procedures that we use in terms of isolating those who are sick, doing contact tracing, all of that is normal procedures for us. What's abnormal in this pandemic is that the scale is just so unprecedented. So normally we'd only have a couple of people working on the communicable disease contact tracing. Now we have over 35 people and growing. So just in the contact tracing, it's a huge, huge number. So we're trying to put out some information and advice to the public to help us stop that spread. And there's many different interventions that we're trying to do here, because remember, what makes this unique to a lot of the other conditions that may arise is that this is brand new. So we're still learning as we go. And that's why you've seen different recommendations as new things have been learned about COVID. And there's no vaccine. So there's no vaccine to protect anybody. So people like to compare it to the flu, for example. Well, the flu, number one, is not as contagious as COVID. Number two, it affects you differently. But number three, and maybe most importantly, is there is a vaccine for the flu, but yet there's no vaccine for COVID. So the rate that that's going to spread through the community is much, much higher. And we're seeing a large number of people across the world contracting COVID. We're seeing a large number of people dying. And what's really important to remember is it's not only just about the deaths, it's about the long-term hospitalizations, the emergency ICU use, and the long-term health effects that could develop. So all of that together is very important to remember. So some of the interventions that we're trying to encourage people to do are some basic steps, but they can go a long way to prevent the spread. So, for example, mask wearing. When you wear a mask and another person that you're talking to wear a mask, you both are protected, and that will help reduce the spread. But then when you layer that with other things such as keeping a good social distance. For example, we're doing this interview via the internet.
That's right.
Typically, I would come to see you in the studio. We're not doing that today. So we're keeping our distance. And then also hygiene and hand washing. Those three things together can make a difference.
One of the things that we collectively know is that we can flatten the curve. We can, but we are looking at individuals in our communities, in our churches, in our just basically in our neighborhoods that feel, I don't need to wear a mask. I washed my hands earlier today,
Mhm.
that are simply not following the rules. And tell us just a little bit how important those three things that you just mentioned are in stopping the spread.
Right, right. You brought up a very good point. The number of cases can be reduced. We're seeing it being reduced in some areas, such as New York City, but then we're seeing it going up in other areas. And what's the difference? The difference is the amount of movement that people are doing, the amount of mask wearing that they're doing, the amount of close contact that they're doing. When you do those things incorrectly, that is going to raise those numbers. And one of the things we hear a lot from people is, well, I'm young, I'm healthy, I'm not really concerned about COVID. I'm willing to take the risk. But the
Right.
problem with that is it's not just about your individual risk. When you do something like not wear a mask or go out when you have COVID, you're putting other people at risk. And that's really the issue, is not putting other people at risk. So even if you're not concerned directly about your safety and your health and whether you think it's going to impact your life, you have to think about your family, your friends, your loved ones, your neighbors, and just everyone else in society, and say, yes, I'm going to have to make a sacrifice. And really, that's what this is about. It's making a sacrifice to the benefit of others. So when you stay home and you don't go out, you limit your trips to the store, you're working from home, those are sacrifices. Yes, it's tough. It's not convenient to wear a mask. It's not
Right.
comfortable to wear a
Right.
mask all the time, but we're sacrificing ourselves to help others. And that's what we have to believe in as a society. And that's really the only thing we can do right now to stop the spread.
And stopping the spread is definitely something that we've committed to be able to do. We're running public service announcements. We
Mhm.
are speaking to people via the website, just like we're doing right now, encouraging people to follow the new rules of our new normal. But one of the things people are so confused about is how serious this disease really, really is. This pandemic has taught us so much. We've seen people go from a cough, a fever, to being hospitalized, to being intubated in ICU, to passing away within a couple weeks time.
Right.
Sometimes you can do it within days. And
Exactly.
people are missing the point that we have every day new things that we're learning about it, because at first it was, oh, black people can't get it. Oh no, it's because the melanin in their skin, they can't get it.
Mhm.
Wrong. Oh, young people, kids, oh, they can't get it. Kids are getting it. Oh,
Mhm.
it's only older people. And you have to have an underlying health problem that is going to complicate it and allow COVID to take over. We're seeing individuals who work out daily, who eat well, who rest well, have been in the best shape of their life, go
Mhm.
from perfectly healthy to being intubated.
Mhm.
And from your standpoint, the seriousness, we've addressed that. How can the public communicate one to another? We've got to work together on this thing.
Right, right. And it's, social media has such a wide reach in our society. And, social media has its good and it has its bad. But one of the good things about social media is the storytelling and the personal storytelling. And I can't count how many times I've seen personal stories about how this has affected people on social media. And that is what's going to make a difference. A friend of mine shared a story about her brother who lives in another city, but had a very bad reaction to COVID, was in the hospital in very bad shape. Luckily, he's okay now. But she tweeted out that story on Twitter, and I contacted her and thanked her and said, "That's the type of stories people need to hear."
That's right.
Because unfortunately, when people have the attitude of, well, I don't personally know anybody who has COVID, so it doesn't exist. And from our perspective, we're in the heartbreaking situation of working on it nonstop all the time. And we're hearing all the stories, and we hear all these stories that are just absolutely horrible. And it's our job and my job to try to impart that information
Yeah.
upon the public, even though it's difficult to hear and maybe some people don't want to believe it or understand it, but it is definitely real. And there's thousands, unfortunately, of examples of very bad results coming from contracting COVID. So we really ask everybody to take it seriously and follow the guidance as it's being developed.
And one of the things that I think is the hardest part for everybody, when you're looking at government officials and they're meeting in very close proximity to one another with no masks on, in addition to that, holding, large, I understand that it's an election year, but
Mhm.
why put people's lives in danger? So when we see that happening, then let's back it down to the local level where churches have begun to congregate again,
Mhm.
where people are doing things in parks and in public spaces, hoping that people will social distance. But I'm the queen of the internet. I will scroll and watch everything, and I'm just not seeing it. I'm seeing people stacked on top of each other, even with the hours of bars being reduced. When they're open, you can scroll through Facebook at any time and see somebody that's going live, and you see people, you know, practically elbow to elbow
Right,
touching.
right.
And it takes us as business owners, public relations people, to take your job on as well and help you
Mhm.
get the word out about the seriousness of this.
Yeah, let me say something about the businesses now that you brought it up. In many ways, the business owners and the workers are on the front lines of helping combat COVID with regards to social distancing, mask wearing. And people need to remember that the employees who are there serving you, be it at a
Mhm.
restaurant, a bar, a retail establishment, a gas station, wherever, they're providing a service to you at risk to them. They're taking a risk by working. So we're asking people to work from home whenever possible. However, if you work at a restaurant, you work at a gas station, you can't work from home. So you're taking that risk by
That's
being
right.
there. So if you go into those establishments and you don't social distance and you don't wear a mask, you're putting that worker who's there to serve you at risk. And we're really asking you to think, even if you don't think the mask is going to help you personally, when you go
Mhm.
into that gas station to pick up your can of pop or whatever you're doing, please wear a mask when you're in there, and be respectful and mindful of those workers who are there just to help you.
And we're talking to Public Health, Dayton and Montgomery County, if you're just joining us. And Dan, one of the things that you mentioned is that wearing a mask, not necessarily for you, because honestly, you could be asymptomatic, a complete COVID carrier, and just going about your daily life and infecting other people who have compromised immune systems, who
Mhm.
have underlying health issues, and you're just chit chatting in the line at the grocery store, or you're chit chatting in the drugstore and you don't have a mask on. And it's because you feel like you're being prohibited from living your life. And you're literally taking the lives of other people in your hand by not wearing a mask.
Mhm.
That is the first thing. The second thing, social distancing. We've preached it 1,000 times. 6 feet. Give me 6 feet. Get back in middle school. Do you remember when people used to say arms length apart?
Yeah,
Arms length
yeah,
apart. So you are not touching. I have come to the place where I think people don't understand personal space,
right.
because you
I
get
was
that?
Hey, I was going to just say on that, you talk about 6 feet, 6 feet, there's a lot of talk about that. That's just an absolute bare minimum recommendation. But really, we're talking about you need to be as far away as possible. So, you know, look at 6 feet as a minimum, but as far away as you can back up, that's the better. So we want people to remember all the guidelines, 6 feet, that's just a rough estimate based on certain conditions. But when you're doing things like singing, laughing, talking
Yes.
loudly, yelling, that's spreading much further the virus. So, you really need a little bit of more distance there.
And that's one of the things that we are talking about today. Public health, Dayton and Montgomery County. We're hoping to set up a regular interview so that we can talk about what the most popular thing is now. As we've said in the beginning of this interview, this virus is constantly evolving and changing, and the way it affects us is doing the same. So there are people who would have died from the virus early on are surviving now. That is maybe the positive turn that I can give to any of this, is that people are surviving. But even at this point, we don't know what the long-term ramifications having had COVID are going to have on your body. We don't know if 5 years from now you have lung disease, you have emphysema. We just don't know. So the better we work together to stop the spread, it's going to be better in the long run, and not worry about what it's going to do to you in the long run. Let's prevent you from getting it today.
Right, right. Um, Along those lines about prevention, we do have some mask giveaways coming up here at Public Health. And there's a complete list on our website at phdmc.org. So I won't run down the dates because depending on when you're hearing this, it may be a different date. But go to that
Sure.
website, and we have our health outreach team out in the community trying to provide masks to people as well as information about prevention and other services. But some people may have issues obtaining a mask or having enough masks. So we have some masks available that we're giving people because unfortunately, as it looks right now, we will be wearing masks for the coming for the foreseeable future. So
Yeah. Yeah.
you want to have a nice supply there so that you don't run out and that you can keep them clean. Remember to wash your mask daily. So I have here's my mask right here today. I'll show you that right there. So
Yeah, that's cool.
I'm in my office. I have the door closed. So there's no one here. But when I go out, I wear my mask, and then this is washable, so I can wash it. And this particular mask has a little insert here of a carbon activated filter that gives you a little extra protection.
Nice.
Put in there, so it's almost like a double mask there. So I really like this type of mask, and it also has a little nose clamp there. So unfortunately, for someone like myself who wears glasses, it could be a problem because it will fog up. So
Sure.
the little pinching there not only helps stop the spread, but it can help stop the fogging of the glasses. So
Well, and that was a question that I was going to ask you before we run out of time. I've seen all over Facebook, social media, where people are making masks and selling them. And I all about supporting small business. I want to be sure that when people are purchasing these homemade masks, are they safe enough? Are they really doing enough to stop the spread, as opposed to masks that we would buy in the store?
Right, right. Well, there's a couple things on that. We do have some mask information on our website, and we do have information about how to make a t-shirt mask. But that being said, there's different levels of protection of masks. So, for example, what's called an N95 mask, that's a snugly fit mask that's specially fitted around the mouth and nose that are usually reserved for healthcare workers. So they'll wear those type of masks. That's the most protection. Then it goes down to a surgical mask type setup that you probably see in many, TVs, movies, so forth.
Sure.
The regular surgical mask. And then it goes down to masks such as this, which, I did buy, or we did buy, but, it's well made. It does have the filter in there. And then the least protective would be a homemade mask. But the point is, something's better than nothing. But the further you can get toward the best, the better. So, speaking of masks, there's discussion about things like face shields, which are the clear plastic shields. Those those don't provide the protection of the mask. Those are used in conjunction with the mask to stop larger particles that may be spraying. And they're particularly used by healthcare workers when they're up really close. I'll use my camera here, up really close to somebody. They'll have that mask there to stop the spray coming into people in conjunction with a face mask. So it's not a substitute. Also, you see the gaiters, like those sport kind of gaiters, those would also be very ineffective you really want to go with a uh, a mask, a mask such as this, or a surgical mask, or if you have access to an N95. But definitely, whatever you do, wear a mask.
And that's the key. We want you masked up. We want you trying to protect yourself the best you can and protect others. And that's what it's about. So on the bottom of your screen, you see us scrolling. Wear a mask, wash your hands.
Mm.
Social distancing can stop the spread of COVID-19. It is very important that we understand that. But then we also need you to visit Public Health Dayton and Montgomery County, the website. There's so much information on that website. And I love the fact that you have printables that you can print the screen so that you can hang it up in your break room if you're back to work. You can have it around your house. There are some great pieces of information that you would think, duh, everybody knows that. No, everybody doesn't know that. And you guys have taken so much time to put together the information for us as a community, and we want you to utilize it. So all you have to do is log on www.phdmc.org and get additional information that can help you as a family, as an individual, or as a worker to prevent the spread. Do the best you can. There are simple things that people can do, like wash your hands. Good old hot soap and water. And let's talk about that briefly. Alternating between soap and water and hand sanitizer. There is some, school of thought that you can't use just one all the time. Switch it up a little bit. It helps.
Well,
What do you think about
yeah,
that, Dan?
soap and water is definitely the best. So if you have access to soap and water, do that all the time, because that's quick, easy, safe, and it's going to give you the best result. The hand sanitizer is supplemental if you don't have access to the soap and water, but definitely, when you're eating, preparing food, wash your hands with soap and water. So I, wash my hands frequently, and then the hand sanitizer is only in the instance where I may not have soap and water available.
That's awesome. Dan, thank you so much for sharing with us today. And we're going to get on a schedule because there are so many things that happen with the COVID virus and
Mhm.
developments that happen. I hate to say it, but almost daily,
Yes.
things that are coming down the pike that we need to be doing or not doing that would help us move to safer precautions. Just with kids going back to school, I mean, people are just all over the place with that.
Yeah.
And it's frightening. It's absolutely frightening. But I think if we do the things that we've been teaching them to do, getting them used to wearing masks, especially the little people, getting used to that being on their face and not sharing masks, not taking it down to talk, and wearing chin masks. There's so many things, but your website does a fantastic job of getting that information all in one place for our listeners and our viewers. Dan, thank you so much for joining us today.
Thank you. Great to be with you.
It's been our pleasure. And if you've missed any portion of this interview, you can find it on our website as well as on our Facebook page, and check it out. It's important, and share it with your friends. Stopping the spread of COVID-19. We're all in this battle together. And if we don't do it, it could literally cost us our lives. I'm Faith Daniels, and thank you so much for checking out Community Focus. I'm Faith Daniels. Enjoy your day.